Hello everyone. Today I am going to discuss about bulky uterus, its symptoms, causes and treatment. What is bulky uterus? A bulky uterus is a generalized swelling of the uterine wall. This means the uterine size is above that of a normal uterus. If the uterus enlarges because of a reason other than pregnancy, it's a serious condition and needs immediate medical attention. A female with a bulky uterus can feel some heaviness in her lower abdomen, and the condition can also lead to extreme pain and bleeding. What are the symptoms of bulky uterus? There are several causes of bulky uterus, and the symptoms may differ based on the cause of it. The common symptoms can be abnormality in the menstrual cycle, pressure on the uterus, bleeding after menopause, frequent and quick urge to urinate, excessive bleeding during periods, which may cause anemia, and gaining weight around the lower abdomen. Now, let's discuss the cause of bulky uterus one by one. First, pregnancy. The most common reason for uterus to enlarge is pregnancy. Second, adenomyosis. Adenomyosis is the diffuse thickening of the uterus that happens when the endometrium, that is the tissue coating the uterus, moves into the external muscle mass of the uterus. It is a non-cancerous condition that has similar symptoms of that of a fibroid. Adenomyosis is usually found in females who are above the age of 30 and particularly in men who had a previous uterine medical procedure or have given birth to a baby through C-section. It is one of the most common causes of bulky uterus. Third is fibroids. Fibroids might be asymptomatic or may cause heavy and painful menstrual cycles. Fibroids likewise put weight on the bladder and the rectum, causing frequent urge to urinate. Fibroids can cause excruciating pain during periods, heavy bleeding during periods, even pain in the lower back and discomfort during sexual intercourse. Fourth is perimenopause. Perimenopause is referred to a stage before menopause. Fluctuating hormone level during this stage may cause the uterus to enlarge. These cases are temporary, and the uterus returns to the normal size once the woman has attained menopause. However, sometimes it might not return to its normal size and cause further problems. So, it is advisable to get it checked by the gynecologist as soon as you face such a condition. Fifth, PCOS, that is polycystic ovarian syndrome. PCOS is a medical condition that can make the uterus grow. It is the after effect of hormonal imbalance that leads to abnormal menstrual cycle and the shedding of the endometrial lining. The endometrial lining is commonly shed during the menstrual cycle, but in few women, the uterine lining is not shed, leading to enlarged uterus. As per the report by WHO, it affects around 10% of the women of childbearing age group. Sixth is ovarian cyst. Ovarian cysts are either solid or fluid-filled sacs that develop on the surface of the ovary or inside it. Ovarian cysts are usually asymptomatic and can go on their own. However, in some cases, the structure can bring about various health complications, including the enlargement of uterus. Other than that, it can cause inflammation, excessive bleeding during periods, pain in the back, and difficulty while passing urine. Seventh, endometrial carcinoma, also known as uterine cancer. This problem happens in females 50 years or above in age. Usually, it is caught rapidly in the beginning stages, as a bulky uterus is one of the symptoms of the endometrial carcinoma. Other than that, it can cause frequent and irregular vaginal bleeding. Women should promptly visit a doctor to identify the problem before it grows into an untreatable cancer. Let's discuss the treatment methods of bulky uterus. Some reasons behind a bulky uterus don't require treatment. However, many might require medicine to help with the pain. Contraceptive pills and intrauterine devices containing progesterone can help with the heavy bleeding in periods. In few extreme cases, women may require hysterectomy, which is removal of a part or completely the uterus. The treatment depends on the cause of the condition, and some of the treatment options are treatment for adenomyosis. It can be medically managed with drugs like ibuprofen and combined oral contraceptive pills, which help to soothe the pain and excessive bleeding related to adenomyosis. In some complicated case, your specialist may prescribe a hysterectomy. For fibroids that enlarge and expand the uterus will presumably require some restorative treatment. Your specialist may recommend contraceptive pills that contain estrogen and progesterone, or an IUCD, intrauterine conceptive device. These pills may stop the development of fibroid and reduce the bleeding during this period. Treatment for reproductive cancers. Cancers or tumor of the uterus and endometrium are regularly treated with radiation, chemotherapy, surgery, or a blend of these procedures. It is vital for women to have a routine pelvic examination with a gynecologist to identify any issue early and save yourself from any future problems. Several reasons for bulky uterus aren't very serious, yet they can be discomforting and ought to be considered. The symptoms of a bulky uterus can be negatively affect a woman's life and might be the reason for you having severe pelvic pain and difficulty in getting pregnant. If you feel an irregular, severe or prolonged problem like cramping, vaginal bleeding, heaviness or swelling in your pelvic region, a frequent urge to urinate or pelvic pain, you should see a gynecologist at the earliest. The problem is first rectified and then it is treated with IUI or IVF as required to help the couple conceive. An early diagnosis will prompt a quicker treatment. How can Medicover Fertility help a woman in dealing with bulky uterus? Medicover Fertility clinics are among the leading European fertility clinics. It is the pioneer in providing affordable yet credible fertility solutions to couples facing infertility issues. It is armed with a state-of-the-art infrastructure, advanced technology, and modern labs for the ease and success of infertility treatment. Today, it is recognized among the top fertility clinics and provides advanced fertility treatment for all the infertility cases as well as conditions that causes infertility.